You're reading a book. Suddenly, there's a dark spot in the middle of the page. Not at the edge, right in the center where the words are. You move the book closer. You move it further away. The spot is still there. You rub your eyes. You blink. Nothing helps. Or you're driving. You notice the dashboard is becoming harder to read. The speedometer is fuzzy. The street signs ahead are blurry. You can see the sides of the road fine. You can see out of your peripheral vision. But the center of your vision, the part you need to drive safely, to read, to recognize faces, that's becoming unclear. Or you're at dinner with your grandchildren. You're trying to see their faces across the table, but their features are vague, blurred. You can make out that they're smiling, but you can't see their eyes clearly. You can't see the details. This isn't normal aging. This isn't presbyopia where you need reading glasses. This isn't cataracts where everything becomes cloudy. This is something far more serious. This is age-related macular degeneration. AMD. My name is Dr. David Miller. I've been practicing medicine for over 25 years. And one of the most devastating conditions I see in my older patients, one that steals their independence, their quality of life, and their ability to do the things they love, is age-related macular degeneration. Here's what terrifies me. Most people don't see it coming. They don't know they're at risk until their vision is already damaged. And by then, prevention is no longer an option. Treatment can slow the disease, but it can't reverse what's already been lost. Let me explain what's happening in your eye. The macula is a tiny area in the center of your retina, the light-sensitive tissue at the back of your eye. It's about the size of a grain of rice, but it's responsible for your central vision. It's what allows you to read, to recognize faces, to drive, to see details. Age-related macular degeneration happens when the macula starts to deteriorate. The cells in the macula, particularly the photoreceptors that sense light, begin to break down. The tissue underneath the macula accumulates waste products called drusen. The blood vessels that supply the macula become damaged. And gradually, over months and years, your central vision fades. The prevalence of AMD is staggering. Studies show that AMD is the leading cause of vision loss in people over 65 in developed countries. 1 in 4 people over 80 has some form of AMD. 1 in 4. That's 25% of the oldest population. But here's the critical part. Most cases of AMD can be prevented or significantly delayed if you take action now. Not in 5 years. Not after your vision starts to fade. Now, let me tell you about a patient of mine named Margaret. Margaret was 72 when she came to see me for a routine eye exam. She had no complaints about her vision. She could read fine. She could drive. She felt healthy. But during her eye exam, I noticed something concerning. There were small drusen, those waste deposits I mentioned, accumulating in her macula. This is early-stage AMD. Margaret was in the early stages of the disease, and she had no idea. I explained to Margaret that she had a choice. She could ignore this finding and hope it doesn't progress. Or she could take aggressive preventive action right now. She could change her diet. She could take specific supplements. She could protect her eyes from damage. She could potentially prevent the disease from ever progressing to vision loss. Margaret chose to take action. She started eating more dark leafy greens. She started taking supplements with lutein and zeaxanthin. She started wearing sunglasses to protect her eyes from ultraviolet and blue light. She started exercising. 5 years later, Margaret came back for another eye exam. The drusen had not progressed. Her vision was unchanged. She still had normal central vision. Margaret had essentially frozen her disease. She'd gone from being on the path to eventual blindness to maintaining perfect vision for the foreseeable future. Now let me explain the biology of AMD. Your retina is exposed to intense light every single day. That light generates something called free radicals, unstable atoms that damage cells. Your eye has natural antioxidant defenses to neutralize these free radicals. But as you age, those defenses weaken. The oxidative damage accumulates. And this damage is a primary driver of AMD. There's also inflammation. AMD is characterized by chronic inflammation in the retina and the tissue underneath. This inflammation damages the photoreceptors. It damages the cells that support the photoreceptors. It damages the blood vessels. Over time, this inflammatory damage is catastrophic. Now here's the fascinating part. There are specific nutrients that can directly counteract this oxidative damage and inflammation. These are natural pigments found in plants called carotenoids. The two most important are lutein and zeaxanthin. These aren't just any antioxidants. Lutein and zeaxanthin have a unique property. They accumulate in the macula. They concentrate in the exact tissue that's being damaged by AMD. And in the macula, they perform a critical protective function. They filter harmful blue light. They quench free radicals. They reduce inflammation. They literally act as a natural sunscreen for your retina. The research on this is profound. The largest eye disease studies ever conducted, the ARDS and ARDS-2 studies, followed thousands of older adults for years. They tested whether nutritional supplementation could slow or prevent AMD. The results were clear. Supplementation with antioxidants, including lutein and zeaxanthin, reduced the risk of AMD progression by approximately 25%. In other words, in people with intermediate AMD, taking the right supplements reduced their risk of progressing to advanced vision loss by 1/4. But here's what's even more important. Dietary intake of lutein and zeaxanthin was even more protective than supplements. People who ate foods rich in these pigments, dark leafy greens, colorful vegetables, certain fruits, had a significantly lower risk of developing AMD in the first place. Let me give you the specific numbers. The recommended daily intake of lutein is approximately 10 milligrams. The recommended intake of zeaxanthin is approximately 2 milligrams. But the average Western diet contains only 1 to 2 milligrams of lutein and zeaxanthin combined per day. Most people are getting only 1/10 to 1/5 of what they need to protect their eyes. Now I'm going to tell you exactly which foods contain the highest amounts of these protective pigments. Kale is the champion. 1 cup of raw kale contains about 11 to 14 milligrams of lutein. Spinach is nearly as good, with about 7 to 8 milligrams per cup. Broccoli contains about 2 to 3 milligrams per cup. Swiss chard, collard greens, and other dark leafy greens are all excellent sources. Other foods high in lutein and zeaxanthin include red peppers, yellow corn, egg yolks, kiwis, grapes, and squash. The pattern is clear. Colorful, plant-based foods, particularly dark greens and brightly colored vegetables, are rich in these eye-protective nutrients. But there's a critical caveat. The way you prepare these foods matters. Lutein and zeaxanthin are fat-soluble. They're absorbed much better when eaten with fat. So a spinach salad with olive oil dressing is more protective than steamed spinach without fat. A vegetable stir-fry cooked in oil is more protective than raw vegetables. In fact, some research suggests that light cooking may actually increase the bioavailability of lutein, the ease with which your body can absorb it. The key is to avoid overcooking, which can destroy the nutrients. Let me talk about zinc as well. Zinc is another critical nutrient for eye health. It's involved in the metabolism of the retina. It protects against oxidative damage. The ARDS studies found that zinc supplementation was associated with reduced AMD risk. But excessive zinc can actually be harmful, so the right amount matters. The ARDS-2 formula, which was refined based on years of research, includes 25 milligrams of zinc, 500 milligrams of vitamin C, 400 IU of vitamin E, 10 milligrams of lutein, 2 milligrams of zeaxanthin, and 2 milligrams of copper. This specific combination has been shown to slow AMD progression. But here's what I want to emphasize. The research consistently shows that getting these nutrients from food is superior to getting them from supplements. The human body has evolved to absorb and utilize nutrients from whole foods better than from pills. Whole foods contain not just individual vitamins, but hundreds of other phytonutrients and compounds that work together to protect your health. So my recommendation is this. First, aggressively increase your dietary intake of lutein and zeaxanthin. Eat dark leafy greens multiple times per day. Make them a staple of your diet. Second, if you have signs of early AMD or if you're at high risk because of family history or lifestyle factors, then talk to your eye care professional about the ARDS-2 supplement formula. Now let me talk about other protective factors beyond nutrition. Ultraviolet light and blue light damage the retina. So protecting your eyes from these light waves is critical. Wear sunglasses that block 100% of UV light. Wear them whenever you're outside, not just in summer. Blue light is everywhere, from the sun, from electronic screens, from indoor lighting. So consider wearing blue light blocking glasses if you spend a lot of time on computers or looking at screens. Smoking is one of the most modifiable risk factors for AMD. Smoking accelerates AMD progression dramatically. If you smoke, Quitting is one of the single most important things you can do to protect your vision. The oxidative damage from smoking directly damages the retina. It increases inflammation. It depletes antioxidants. It's devastating for eye health. Weight and metabolic health matter too. Obesity is associated with increased AMD risk. Metabolic syndrome, high blood pressure, high blood sugar, obesity, abnormal cholesterol, increases inflammation throughout your body, including in your eyes. So maintaining a healthy weight, controlling your blood pressure and blood sugar, and managing your cholesterol are all important for eye health. Exercise helps as well. Regular aerobic exercise reduces inflammation. It improves circulation. It helps maintain a healthy weight. It improves metabolic health. All of these factors protect your vision. Now let me tell you about the different types of AMD. There's dry AMD, which accounts for about 85% of cases. In dry AMD, the macula gradually deteriorates. The drusen accumulate. The cells break down. Vision loss is usually gradual. This is the type of AMD that responds best to prevention and early treatment with supplements and lifestyle changes. Then there's wet AMD, which is less